All right, hello everyone. My name is Paul Castleman, and my project will be on alcoholic liver disease. If you'll pardon the camera, my computer's camera is not functioning currently. Yeah, moving on. All right, alcoholic liver disease. As you can see, it is damage to the liver by overconsumption of alcohol, according to Judith Marson, MD of Medical News Today. This can lead to a buildup of fats, inflammation, and cause scarring or cirrhosis. And pictured, we have a healthy liver on the left. Notice the deep red. And over on the right, you have a cirrhosis liver, which is covered in fatty deposits, the yellowing, and scar tissue, which is the cirrhosis part. It is the primary cause of chronic liver disease in the West, third most common cause of transplants, and second most common cause of liver cirrhosis after hepatitis. Modifiable and non-modifiable risk factors. All right, now types of alcohol consumed. Beer and liquor are going to increase your risk for alcoholic liver disease, while wine, the risk is still present, but not as pronounced as beer and liquor. Now, the amount of alcohol you consumed is another part of that. Man, if you're having 3 or more drinks a day for 5 or more years consecutively, your chances are going to go way up. Ladies, same for you, except 2 drinks a day for 5 or more years. Excess body weight and obesity, by definition, alcoholic liver disease, fatty deposits on the liver. If you've already got an immense amount of fatty deposits on the liver, it's just a double negative there. And minding your nutritional status. So you want to be eating the right kind of foods, eating the appropriate amounts of proteins, fats, carbohydrates. Excuse me. So be mindful of what you're putting into your body in addition to the alcohol. So eat right. Non-modifiable. Gender's a pretty big issue. While there are more cases of men having it, I'm sorry, guys. Excuse me. While there are more cases of men having alcoholic liver disease, for women, it's more rapid onset. All right. Once you get it, it's going to progress a lot faster than it is in the male counterparts. Now, if you have a pre-existing condition such as Hep C, alcoholic liver disease or alcoholic hepatitis is the second biggest chronic liver disease. So if you got the top two liver diseases, again, it's a double negative that you just don't need in your life. Okay. Genetic changes. All right. Now your liver, it processes the toxins in your body, and alcohol is a toxin. It is metabolized by certain liver enzymes that break it down and either distribute it or push it out of excrete it into your kidney system, and then which pushes it out of your body. Now, if you've got a defect in some of the enzymes that do that in the metabolization of alcohol, you're going to have a problem. Those key enzymes are ADH, ALDH, and CYP4502E1. It's a specific liver enzyme that breaks down alcohol. Who's at the greatest risk? Well, as you can see, on the left side, the squares represent men, and on the right side, you've got a few different variations because it includes Hispanics into this mixture. Now, this chart is a little dated, but the data is obviously still there. So variations do exist through the ethnicities. However, in recent years, they show a declining rate. As of recently, the alcohol intake of black men compared to white men, black, both men and women, and white men and women have been narrowing the difference in a positive sense, meaning they're not going up, the intake is going down, everybody's getting to a more health conscious lifestyle. There are higher rates of cirrhosis in Black Americans than white Americans, but the highest rate is in Hispanic Americans, or the Latino and Latina groups. All right. Next is prevalence. All right. So there are 88,000 cases of alcohol-related deaths per year in the United States alone, and 62,000 of them are men, and 26,000 of them are women. But just remember, ladies, there are maybe less cases for you, but it progresses a lot faster in you than it does men. So, excuse me. 1 of 3 with advanced stages of liver disease are now living past 2 years, which is a huge boon. Thank you to medical technology. But it comes with caveat. 10 to 13% of self-proclaimed alcoholics have developed cirrhosis. Now, this is a behavioral-related disease, and those who drink heavily are the usual ones affected. Little caveat to what I wrote down there. Speaking with my father, who's a medical professional, he's a doctor, and while if someone is drinking maybe 1 or 2 glasses of wine a week, every 2 weeks, once or twice a month, the risk is still there. However minute, it is still there. The only way to negate it is to completely abstain from alcohol. So just be aware. However, if you are a self-proclaimed alcoholic and you are binge drinking regularly, daily, nightly, your rates are going to skyrocket. Now, as you can see here in prevention, the primary prevention, the guidelines classify moderate drinking as 1 drink a day for women, 2 drinks for men, and this study was for people over the age of 21. This classifies drinking in moderate and binge, as prescribed before. Moderate binge drinking, as defined, is 5 drinks in 2 hours for men, and for women is 4 drinks in 2 hours. Now, a drink is classified as 12 ounces of beer, 5 ounces of wine, and 1.5 ounces of liquor. So just bear that in mind. Other preventive things you could put into place, as explained before: drink alcohol in moderation, if at all. If you want to completely remove yourself from the possibility of getting alcoholic liver disease, just remove alcohol from the equation. Also, another big one, Hep C. Protect yourself. Don't share needles. We should know this as medical professionals. Don't share personal items, and avoid direct exposure to blood or blood products. Wear your PPE, personal protective equipment, gloves, gown, mask, gloves, face mask if you need to, which may be the case in some surgical theaters. Choose tattoo or piercings carefully. That's a big one for me. I haven't met many of you in person, but I have a lot of tattoos, and you got to be very, very careful. If they're not pulling out clean stuff out of sealed containers, go to a new place. Practice safe sex, another big one that we should all be preaching about. Wear condoms, be very selective about who you do certain activities with, all right? So protect yourself is the big thing here. Check before mixing medications and alcohol. If you have questions, talk to your doctor, talk to a nurse, talk to any medical professional, talk to your pharmacist, talk to the pharmacist at CVS or Walgreens. They will tell you that alcohol can interact with medications in a way of boosting the effect or decreasing the effect. So there's a risk of bottoming out or just going way overboard. So exercise and proper diet. Like I said before, healthy body, best way to fight off an infection is you want to have a healthy army of white blood cells, healthy immunity. All right, detection. Detection generally is based on signs and symptoms. Just like when most people get sick, they're going to go see the doctor. If you're having regular loss of appetite, nausea, vomiting, abdominal tenderness, fever, low-grade fever, or high-grade fever if it's the case, or having fatigue and weakness regularly or chronically, you're going to go see your doctor. If they can't figure out what's going on by an assessment, they're going to draw blood for testing or other things and do liver tests, which will um, includes a CBC. All right. If you're having confusion behavior or altered mental status, that's a big one. Nobody with an altered mental status needs to get behind the wheel of a vehicle. All right. God help us if any of us have that happen and all of a sudden we don't know what we're doing behind the wheel of a vehicle. Another one that's a little bit, you have to kind of know what it is you're looking for, is fluid accumulation in your abdomen or ascites. All right. So, and then one more, the most common sign of alcoholic hepatitis is yellowing of the skin and the whites of the eyes, or jaundice. This is a breakdown of red blood cells. Your liver is a huge repository of red blood cells, and if they're bursting when they're not supposed to, they're going to be releasing bilirubin. So that's a good thing to look for. If you're in there and you're having difficulty controlling your drinking, or you want to cut back and you feel like you don't want to live this way anymore, talk to your doctor. I mean, no doctor is going to turn you away because you're seeking help. Same with any other medical professional. All right. Diagnosis confirmation. As I said before, they're going to test your liver function with check your liver enzymes and the CBC, and if they have to, they may have to get a liver biopsy. But it's all going to start with a good history of alcohol use, as they've been hammering into me in my nursing courses. Good history on everyone. Treatment options. Abstinence, obviously, is the biggest one that would prevent you from catching this illness. Lifestyle modifications and diet and exercise. Healthy body, healthy immune system. Hand in hand right there. Healthy army of white blood cells. If you're not mentally capable of handling it, there's psychological therapy, which goes hand in hand in self groups. If you'd rather be in the anonymity of a group, there's Alcoholic Anonymous, for example. If you'd rather do one-on-one in privacy, you could go see a therapist. Now, pharmacotherapy, you've got a comprosate, which is you're going to be your first treatment option. What this is definitely the most effective after you've achieved abstinence. What it does is it reduces inflammation of your liver. All right, alcoholic liver disease can cause inflammation. So, next is your naltrexone. All right, this one you have to be careful with because it's an opioid antagonist, and as everybody knows, those opioid receptors in your brain. That's if someone's reliant on opioids for pain therapy, therapy regimen. This is going to really throw a huge wrench into that and mess things up. Disulfiram, what this does, along with naltrexone, is it reduces your craving. The difference is disulfiram gives you a very unpleasant physiological reaction. This can, as we all know, different drugs affect different people in different ways, but disulfiram, the primary unpleasant physiological reaction, you'll feel an aversion when you have alcohol intake. Excuse me. And you're just not going to want to crave it anymore, or you're not going to crave it as much anymore. If you're having difficulty with those, specific treatment could be corticosteroids or pentoxifylline. This is another one that's used for inflammation of the liver in some people. Finally, transplant. If your liver is so far gone that you need to transplant, there's a cornucopia of things you're going to have to do. You can't have a history of substance abuse. You can't have alcohol for the previous 6 months. You can't have any active infections or other diseases or conditions, because it may cause your body's refusal of the organ. Or if you've got documented medical noncompliance, who's to say you're not going to comply on the medical regimen for the new liver? So keep those in mind. And thank you, everyone. I really appreciate your support. It's been great getting to know you all. Have a blessed Easter, and equally so with our finals. Have a great day.